Well, what are venous ulcers? I like to show this picture so patients can see that the circulation, how it can be affected. So here's the leg. These dotted lines that you see are the fascia. This is what lines the muscle, okay? So you have your superficial veins on the outside of that fascia. Then on the inside you have deep veins. Connecting those two, you have perforators, and it's kind of like a ladder rung, so to speak, if you'd kind of think of that. Every time you walk, the calf muscle pushes, and it's squeezed basically because that fascia really doesn't move a lot, and it pushes the blood from the superficial vein over into the deep vein, and then it goes back into the heart and into the circulation. Well, in these perforators, in these veins, you have little leaflets or little one-way valves, and those can become faulty too, and that causes problems. So you think, well, gosh, how do you get this venous disease? Well, it can be from your job, all the years. Maybe you worked at a gas station and you stood all day, or you had a job where you sat all the time. People that have congestive heart failure can have this, and the fluid back up. People that are obese, you see when ladies are pregnant that their legs will swell as the fluid builds up, and so that backs up. So this is just a really good picture. When patients come in with venous leg ulcers, okay, we're treating symptoms, okay? So we're gonna treat the wound, yes, but then we wanna get you to a vascular surgeon who can look in detail at that circulation and say, hey, is the problem in the superficial veins? Is it the deep veins? Is it the perforators? Or is it a problem with the valves? And so we want your problem corrected so you stop having so much trouble and have all these chronic problems with these wounds. So again, some of the treatments that we do are compression, okay? And we're gonna find a compression after we treat your wound that's gonna fit your lifestyle. A Velcro wrap is just one of the type of wraps. We do zipper wraps. We have the kind that you pull up. We actually have what we call donning devices, because it is hard for people to pull that compression up on their legs a lot of times. So we have devices that you can purchase for little or no expense, and you put your stocking in there and it helps you pull it up. So come see us at Wound Ostomy Care Clinic. Also, we have a Facebook that you can follow.